So I went into Dunedin Hospital 3 times yesterday to meet with the gentleman, Alec Cleghorn, and eventually the meal arrived, and I had a little taste. I didn't want to eat very much because it was his dinner, but really I relied on what he had to say about it because it's his voice and his views that mattered.
Okay, now interestingly, he's previously been in Oamaru Hospital, right, which is not a campus hospital. They provide their own meals. And what was his comparison, Dunedin versus Oamaru?
He said that the meals at Oamaru Hospital were 200 times better, that they were fresh, that they were tasty, that you could actually taste the food and the texture of the food, and they were bigger portions. He said there was no comparison at all, really.
Okay. The point here is, isn't it, that the DHBs are all desperately trying to save money. So on the one hand, you've got people saying, give me Keytruda for my metastasized melanoma. On the other hand, you've got people saying, feed me better meals. Can you see why the DHB might have done this? Outsourcing, trying to reduce the cost of food?
Well, these are people who are in hospital because they're sick, they're having operations, they actually need to be fed nutritious food. I don't think anyone's asking for 5-star meals, but we don't want the people who are so vulnerable to be given food that's been frozen, has been reheated, and or has been heated, and is not tasty and is unappetizing. I think it's a bad look for our country. It's certainly most of the hospitals around New Zealand, the DHBs decided not to go with this compass model. Our DHB did, and it was false economy really. And I don't think they're going to save much money. Instead, they've ended up with a big an unhappy community. Everyone in Dunedin is talking about this issue. I suspect everyone around the nation knows about it. It's a brand problem for Dunedin Hospital, and I think really they have to fix it.
Have you had complaints from people?
Oh, absolutely. I mean, that's why I think just over a week ago, I was contacted over Easter by somebody, a woman who was really angry that her mother had been served really unappetizing food. She had an elderly mother and she had a hip operation or something, and she wanted something to be done about it. And she contacted me directly and said, Claire, can you do something? And I thought, well, I'm not really sure what I can do other than to try and make this issue public. And so I've been trying to do that. But ultimately this isn't about politicians. It's not about what Jonathan Coleman thinks of the food or what Claire Curran or Annette King thinks of the food. It's what the patients think, and it's about their experience of it and whether or not it's actually good for them. And my concern is that it isn't.
You say it's not about what Jonathan Coleman, who's the health minister, thinks of the food, but having said that, he was served food there. Is it your understanding that what he was served was representative, truly representative of what was going out across the wards that day?
Well, I'm hearing from a lot of people that it wasn't. I think the way that they did that was stage managed and unfortunate. I think it led to people being suspicious, and the way it looked, it didn't look like any of the other meals that I've seen. And I think that was the reaction from the community. And this was from people who are inside the hospital. And I think that we have to listen to them. They're the people who are being served up this food every day. And they're also the people who are working in the hospital who feel embarrassed that they have to serve up this food, or that they are working alongside. They're the nurses, the doctors who are seeing people receiving this food. Sometimes they're actually going down to the kitchen and making sandwiches because the food is so bad.